interesting case, a 2-month-old male child who strains before passage of stools. It's been noted by parents for the last 5 days. What happens is the child strains a lot, cries, face turns red, and sometimes the child passes stools successfully, sometimes not able to pass even after straining. But the stools are not in form of palate, rather they are not hard at all. And the examination of the child, including anthropometry and weight gain, is normal. So my question is, what is this condition? Have any of you faced this child in your training, or have you read this condition in books?
Yeah, so requesting, what is FC? Somebody has written FC. Is that functional constipation?
Functional constipation.
Okay. Any the stenosis? Stenosis of what? Think more. This is a very specific kind of presentation, and you have a very specific diagnosis for this. Anal fissure is another answer. No fissure has other presentations. Anything else? Anal fissure. Okay, Dr. Dheeraj, any comment on anal fissure? 2 or 3 people have written
anal fissure will either happen either following diarrhea or following constipation. Anal fissure will present with more of blood tinged stools, and anal fissure, ultimately the constipation happens either because of fissure the child voluntarily retains the stools and develops constipation, or anal fissure could be a manifestation of constipation. So this is not the presentation of anal fissure. So
there are 2 more answers, Dr. Dheeraj. Again, lactose intolerance, and another answer is by Dr. Rajkumar, Dyskinesia. Or Dysphagia, how do you pronounce it?
So definitely this is infant dyskinesia. So this is a condition where
So Dr. Rajkumar has written is the correct diagnosis.
Yes.
Okay.
So this is infant dyskinesia. So this is incoordination between the pelvic muscle contraction and relaxation of anal sphincter. So it is kind of incoordination between the stimulus which goes from brain to cause pelvic contraction of the muscles and to relax the anal sphincter. So there is incoordination, and because of this incoordination, the child is unable to pass stool. And then what the child tries to do is tries to contract the abdominal muscles, including that of diaphragm. The child appears very sick, the child appears to be in pain, and child appears to be grunting because the child is contracting the diaphragm. So this child is not very sick. The child appears to be very sick to the mother or the parents while passing stools. The child is just making all the efforts to contract the muscles and somehow throw out the stools, but the child is unable to do so. And when the child tires after 10 to 20 minutes, then the child gets relaxed, and after relaxation, the stool may be passed. So this is infant dyskinesia. It is a learning phase for the child. It is supposed to be common. 1 to 5% of the child have been reported in various settings with infant dyskinesia. So it is commonly misdiagnosed as constipation. Unnecessary laxatives are prescribed and unnecessary lubricants are being prescribed for this condition. So if you know this condition, this is very typical presentation, infant dyskinesia. So but you will be able to diagnose this only if you know it.
Dr. Dheeraj, obviously as the supplementary question, once again, any investigations required? Because the diagnosis is already.
The history is very typical. There is no investigation required, and it's a self-limiting condition, and it subsides spontaneously in few weeks' time, and definitely by 6 months of age, this condition definitely subsides. So only the parents need to be reassured, and the child needs to be comforted during the episode, and the child will slowly learn. Most often, the children learn in about a week only time how to pass this stool. So this condition persists for about a week and then spontaneously starts resolving.
Thank you. I think we are halfway through, so time to pat our backs, and the participants are also patching our back. We have this from Prachi, who says very nice cases, and thumbs up also twice. Thank you very much for raising our morale and giving appreciation.